The demonstration you're about to see of Innomed's Nasal-Aire 2 will show you the benefits and features of this revolutionary product. The Nasal-Aire 2 is an accessory to positive pressure ventilation for patients with obstructive sleep apnea. Nasal-Aire 2 provides higher patient comfort levels over standard masks, which constrict nasal passages. Nasal-Aire 2 brings relief to those suffering from obstructive sleep apnea. Uncomfortable masks and bulky headgear are the most common complaints from patients who use CPAP therapy. The Nasal-Aire 2 reduces that claustrophobic feeling often associated with masks. It's easy to use and is virtually leak-proof around the seal. Nasal-Aire 2 is latex-free. A soft nose piece and 2 soft nasal inserts allow for true fit and comfort inside the nasal passages. The 2 tubes are joined at the opposite end by a Y-shaped coupling, forming a complete circuit with the nose piece on one end and the Y-shaped coupling at the other. At the base of the Y-shaped coupling is a built-in swivel that will connect the Nasal-Aire 2 into a positive pressure ventilation device. This allows for maximum movement and positioning. Because proper size and fit are very important, we recommend a home healthcare provider use a sizing gauge in conjunction with the new patient setup kit. The kit includes 3 nasal cannulas, 1 tubing set, and 1 headgear for optimum fit and comfort. To maximize security with the Nasal-Aire 2, follow the technique we have provided for you. The Nasal-Aire 2 comes with an optional headgear. To use the optional headgear, slide the figure 8 loop onto the end of the headgear. Insert the neck strap through the bottom loop section of the figure 8 loop. Place the headgear on the head. Fasten the top strap for comfort. Secure both hook and loop fasteners. The tubing holder ring should be positioned near the ears. Disconnect the nasal section from the Nasal-Aire 2. With the Y swivel coupling on or near the chest, place 1 tube around and behind the ear. Slide it through the tubing holder ring that is on the headgear and pull the tubing toward the nose. Repeat for the other tubing. Reattach the nasal section to Nasal-Aire 2 tubing. Place the nasal inserts into the nostrils. Rotate the nasal section for a comfortable fit. To use the Nasal-Aire 2 neck strap, loop one end of the hook and loop fastener tab around Nasal-Aire 2 tubing on one side. Loop the other end of the hook and loop fastener tab around the tubing on the opposite side and adjust for a comfortable fit. A bolo attachment is provided for added security. Secure the bolo around the tubing on the chest. Adjust for comfort. The Nasal-Aire 2 is intended for single patient use. It can be cleaned and reused up to 90 times. To clean, disconnect the nasal cannula from the tubing. Wash with warm water and pure soaps only. Bleaches are not recommended. Rinse well to remove residual soap. Then, air dry out of direct sunlight. Before reassembling, inspect Nasal-Aire 2 for signs of wear and tear, such as rips, holes, or cracking. Discoloration after several washings is considered normal and won't harm the product. Discard with signs of wear and tear. See your home care or healthcare provider for replacement or further questions. This product is available by prescription only through a qualified doctor. Innomed's revolutionary Nasal-Aire 2 is clinically proven and tested and is available worldwide. For more information about Nasal-Aire 2 and our other products designed to help you rest easier, visit us on the web at nasal-aire.com or innomedinc.com. Nasal-Aire 2 with reduced noise level, 6 sizes available, and a softer nose piece. a better night's sleep right under your nose.